making cars moves us. What moves you?
A JCAHO inspection team spent 4 days at GMH last week to examine whether or not the hospital's hard-won accreditation should be renewed. Administrator Joseph Verga says that they were generally positive at the exit interview.
They were very complimentary about our infection control program. In fact, they even cited a best practice here in Guam for our transfer documentation, saying it was the best that they've ever seen. They said this at the exit. Senator Rodriguez was there, so we had a lot of people that heard it.
But there were two issues of concern.
One has to do with nothing new. It has to do with the lack of adequate resources that could affect patient safety, and that has to do with the debt and the adequate resources, or the lack of resources, and of course at times being on credit hold for supplies and things of that nature.
The other issue JCAHO was concerned about is the physician peer review process. The controversy over the suspension of Dr. George Macris's medical license and the subsequent settlement last year voiding that decision divided the hospital because it overturned the peer review process. But Verga says he changed that process when he arrived last summer.
Since my arrival here, we've implemented a new peer review model with new patient care indicators, and they were very, very pleased with those and said that they were as good as any on the mainland. The problem is, Kevin, is they require a year's track record, and we've only implemented them for about 6 months.
JCAHO accreditation is important because it ensures prompt Medicare and Medicaid reimbursements without a separate inspection from CMS, and it helps ensure prompt payments from health insurers as well.
Could either of these issues jeopardize accreditation?
I don't think so. However, we will be having a conversation, submitting a corrective action plan.
Verga remains confident, but the central issue remains the same as it has been for years, and that is money.
It's going to take the support of the legislature, the governor, and the support of government going forward. So we're going to be presenting, and we're still working on ferreting out the details, the budget this year, which is going to correct a lot of the inadequacies of the past.
The hospital probably won't know whether or not they have won reaccreditation until June.
We will not know whether or not we're actually reaccredited, probably at least for several weeks yet. At least we get the preliminary report, and then we have 45 days to respond to the direct findings. So it will probably be sometime June, late June, before we know whether or not we are actually reaccredited.
Kevin Kerrigan, PNC News.